My name is Maggie. I'm a registered nurse and I'm going to be doing a full head-to-toe assessment. Can you tell me your name?
Colby Burris,
Can you tell me your date of birth?
3/26/87,
And what day of the week is it?
Saturday,
And where are you at?
Farmington,
And who's the president?
Barack Obama.
And the patient is alert and oriented ×3. Her gait was normal when she came in today. She doesn't appear to be in any pain, no grimacing, and she's appropriate height and weight for her age as well. And also I'm going to be doing a skin assessment on you. And there's no lesions present. The skin is warm and dry. And trigger is less than 1 second. There's no cyanosis. Cap refill is less than 1 second. Hair is evenly distributed on her arms. And there is no edema of the lower extremities. And cap refill on her toes is also less than 1 second. I'm also going to inspect your head. Hair is evenly distributed and no lumps or bumps. I'm also going to check your cervical spine. Do you have any pain here?
Nope.
Okay. And also going to check your ears. At this point, I would use a tuning fork to test cranial nerve number 8. And I would use an otoscope to go ahead and look at her ears and see if the tympanic membrane was gray. There's no lumps or bumps present on her ears, and I would check behind them as well. And there's no masses present. Also going to check her lymph nodes, the occipital, and the cervical, submandibular. You're going to check for any swelling or pain, the submental, and the supraclavicular lymph nodes. Any pain with any of those?
Nope.
All right. Also going to check her eyes. Also going to check your hearing a little bit too. And tell me what I'm saying.
Colby
Burris.
Burris,
Okay. And hearing is also appropriate. And on her eyes, I'm going to go ahead and check if you can look at the wall behind me. Okay. And the pupils constrict with light, which is a normal finding. And they also accommodate. I'm going to check the 6 cardinal fields of gaze. And you hold it the lateral to check for nystagmus, which she does not have, so her eyes are perla. Accommodate appropriately. Also going to check your peripheral vision. If you can tell me when you see my fingers.
no,
Okay.
no,
Okay, perfect. And then on to the nose. I'm going to look at your nose. It is midline. If you can go ahead and look up for me. The septum does not appear to be deviated. Do you have any trouble breathing at night?
yep,
If you can close one side of your nose and take a deep breath in. Good. And do the same on the other side. All right. And no pain with your nose. Do you have seasonal allergies?
yes,
Okay. And then also I'm going to check your mouth. The lips are symmetrical and pink and dry. If you can go ahead and open. The mucous membranes are also pink. And I don't see any caries. No teeth are missing. If you can go ahead and stick your tongue out. That's checking cranial nerve number 9. And if you can raise it to the roof of your mouth. No masses are present. And stick your tongue out and say ah.
ah,
And the uvula is midline and the soft palate raises symmetrically bilaterally. I'm also going to check your neck. And trachea is midline. And go ahead and swallow. Good. I don't feel any nodules on the thyroid. I would also check her gag reflex and her swallow reflex to make sure they are intact, which they appear to be. She already said she didn't have any cervical spine pain. I'm also going to get you to shrug your shoulders. Good. And then turn into my hand. Good. And again. And that's checking cranial nerve number 11, which also appears to be intact. And if you could go ahead and touch your ear, each shoulder. Good. And then back and forward and touch your chin to your chest. Her range of motion is appropriate. And are you having any pain when you do that? Okay. All right. And I'm also going to do a lung assessment on you. Do you have any trouble breathing at all? No. I'm going to check for tactile firmitus. If you can turn your legs this way for me. And if you can say the word 99.
99,
again.
99,
And again.
99.
And I'll check that using the ulnar side of my hand. I'm also going to listen for vocal resonance as she says 99.
99, 99, 99, 99, 99, 99, 99.
And while I'm back here, I'm also going to check breath sounds. Take a deep breath. And when I'm checking breath signs, I'll go side to side systematically. A deep breath. Good. And if you can take a deep breath. On this, I'm going to look for my thumbs to separate equally bilaterally, which they do. I'm also going to percuss the lung fields and listen for any dullness. Which I would also go side to side systematically to listen and compare sides. And there's no dullness heard. If you can go and take a deep breath in for me, hold it. Okay, and let it out. And again. Good. And you can go ahead and let it out. I'm going to listen to your breath sounds on the front as well. Deep breath. Turn to the side. I'm also going to check your spine for any pain. There doesn't appear to be any kyphosis or lordosis. Any pain when I'm doing this? No scoliosis is present. The vertebrae are lined up midline. And if you want to go ahead and turn around to the front, I'm going to assess your heart as well. And for this, I'm also going to check carotid bruits, or 4 carotid bruits with the bell end. Bruits are heard. I'm going to listen to the points on her heart, starting with aortic, going to pulmonic, into Erbs, tricuspid, mitral, the apical pulse, and I would listen for 1 full minute to get the apical rate here. And with her respirations, I've noticed throughout the exam they're normal. She's not using any accessory muscles to breathe. I don't see any cyanosis of the periphery or around her lips, which is what you would be looking for there. I'm also going to feel for any heaves or thrills, and feel for the apical pulse. And then I'll go ahead and move on to your abdomen. And if you can turn your legs this way, and go ahead and lay down for me. And first I'm going to inspect. No distension or discoloration. Look for any scars. And I'm going to listen before I palpate for bowel sounds. Bowel sounds are present in all 4 quadrants, and I'm also going to listen for an abdominal brewing and the aortic brewing. Also in the renal areas. And no bruise are heard. I'm going to go ahead and percuss now. dullness over the liver, which is normal. More tympanic over the air. Alright. And do you have any pain here? And go under the ribs a little bit on the right side to palpate the liver, and the swing over on the left side. No masses are noted. If you want to go ahead and sit up and turn your legs this way, I'm going to check for range of motion. If you can move your shoulder, good. Slight crepitus, but nothing out of the ordinary. And then with your legs, if you can lift your leg up, good, and put it down. And again, good. And then you can lift your wrist up and down. And on this side too. Good. And with your elbow. And on this side. Any pain when you do any of that? Nope. Good. And then I already checked your spine. There wasn't any crepitus felt. I'm also going to check your neurological status, which I've somewhat been doing throughout this exam, but if you can blow your cheeks out for me. Good. And raise your eyebrows. So the facial cranial nerve is intact as well. And with the checking the cardinal gazes, I checked cranial nerves 3, 4, and 6. And then also, if you can close your eyes for me and just tell me where I'm touching you at.
Cheek. Forehead. Chin.
Very good. And then if you can keep your eyes closed and let me see your hands and tell me if I'm lifting your fingers up or down.
Up. Up. Down. Up. Down. Down.
Very good. And then I'm also going to check your reflexes. Very good. And I'm also going to check your pulses, which I'll check carotid one at a time. I'm going to check brachial pulses, which are equal bilaterally. And radial pulses, which are 2+ and equal bilaterally. I'm also going to check the popliteal behind your knees. And then the post-tibial behind your ankles, and then dorsalis pedis on top of the foot, which are all equal bilaterally. And that concludes my full head-to-toe assessment today.